over half of Kenyan youth are hesitant to get COVID-19 vaccines. That's according to a recent study by the non-governmental organization AMREF Health Africa. The research found that a section of youth were waiting to see the effects of the vaccine on those who have received it before deciding whether or not to get inoculated. A separate study focusing on community health volunteers showed that 81% would accept a COVID-19 vaccine. Here's CGTN's Wilkister Nyabwa with the details.
Persistent vaccine hesitancy continues to pose a global challenge even as countries across the world work to ensure more of their populations receive vaccinations against COVID-19. Vaccine hesitancy is a refusal or the delay in accepting vaccines. In the study conducted by the international health non-governmental organization AMREF Health, only 42% of youth in Kenya were ready to take the COVID-19 vaccine. Of those who were not ready to be vaccinated, 52% said they were waiting to see the effects of the vaccine on those who have received it. 6% were completely unwilling to receive the vaccine. A section of those rejecting the vaccine pointed to social media as their main source of information. A number of experts have blamed the slow uptake of vaccines in parts of Africa on concerns about safety and efficacy of the vaccines. However, it is difficult to quantify the impact of these factors on the vaccination process. Africa, whose 1.3 billion people represent 16% of the world's population, has administered about 57 million vaccine doses, and even where vaccines are available, persistent vaccine hesitancy remains a key barrier to achieving herd immunity through mass vaccination.
We know that in the control of this pandemic, vaccine hesitancy is the one thing that is going to delay our control of the pandemic, and especially in Africa, where the hesitancy seems to be higher than in other places.
In Malawi, health experts say skepticism about vaccines has played a role in the slow distribution and eventual expiration of doses. In the Democratic Republic of Congo, inoculation campaigns have been hampered by concerns about the rare blood clots related to the AstraZeneca vaccine. A separate study revealed that 81% of community health volunteers were willing to accept the vaccine and engage their communities about it. The remaining 19% cited concerns over the safety of the COVID-19 vaccine as their main reason for rejecting it. AMREF's study on vaccine hesitancy sought to assess Kenyan youth's perceptions of the COVID-19 vaccine as an entry point to planning a countrywide vaccination program. Experts now recommend measures which include designing robust communication about the COVID-19 vaccine in order to halt misinformation campaigns. Wilkister Nyabwa, CGTN.